Hi, I'm Monica Hendrickson, the Public Health Administrator for the Peoria City County Health Department, and welcome to our weekly Facebook update. As of September 24th, the TriCounty of Peoria, Tazewell, and Woodford currently have 5,459 cases to date. That includes 3,358 for Peoria County, 1,686 from Tazewell County, and 415 for Woodford County. Overall, this is just under 500 new cases in our Tri-County over the past week. We're also sad to report that compared to last week, we have 9 additional deaths in the Tri-County, taking our to-date total to 74. That includes 1 new death in Peoria, bringing our number to 44, 8 new in Tazewell County at 24, and no new in Woodford County. The Tazewell County death, newest Tazewell County death we report is to a resident female in her 70s who was not residing in a long-term care facility. Overall, while our numbers continue to grow, we also see that the number recovered continues to grow, with 81.4% of our cases considered recovered and 16.6% at home and isolating. Our hospitalization has remained steady at just under 1%, so 0.7% overall. In regards to our hospitals of Unity Point Health, Methodist, Proctor & Pekin, as well as OSF St. Francis Medical Center, they're reporting 2 persons under investigation in the ICU and 18 confirmed cases in the ICU for a total of 20 cases in the ICU and 38 cases in non-ICU beds. They're also sad to report 1 new death in the past 24 hours. Overall, compared to last week, we have seen a decrease in the number of new cases in the Tri-County. But as we move to cooler weather, we need to continue those safe practices to prevent the spread of COVID-19. Today, the Illinois Department of Public Health, or IDPH, released great information, which is available on their website, and a link can be found on the websites for Peoria City County Health Department as well as Tazewell and Woodford regarding those practices for small social gatherings. And when we continue to move into the fall, where not only does the weather get cooler, but we also now have holiday activities, we really need to remember that these guidelines help us with understanding what we can do to prevent the spread of the virus. And so some of that includes starting new traditions, such as virtual events, avoiding exposure 2 weeks prior for any in-person events, as well as if you are traveling, taking additional precautions. Likewise, you want to think about if you are elderly or immunocompromised, prevent not necessarily going to these in-person events, but trying to, again, do something virtually as a way to gather. And also, as much as possible, do activities outside. If you do need to bring it inside, keep that 6-foot radius, wear a mask, and limit the numbers of individuals available. The biggest thing, too, is to make sure you get your flu vaccine prior to traveling and attending parties and get-togethers. The key is to plan and prepare so that we share happiness and not COVID-19. With that, continue to stay safe and healthy.